The hearing will come to order, and good afternoon. And I want to thank you all for being here, especially our very two distinguished witnesses. There will be a couple of breaks, unfortunately. We have some votes coming up very shortly, but we will stay at it because this is an extremely important issue, and I want to thank you for the work you've done. By holding today's hearing, this subcommittee is fulfilling a very important obligation to the American taxpayers to conduct vigorous oversight of our global health programs in order to ensure that U.S. taxpayer dollars are being used properly and efficiently to deliver the aid to rightful beneficiaries. It is also, we hope, will help better the lives of those beneficiaries in the developing world who receive life-saving medications thanks to the generosity of the American people. Specifically, we will address serious concerns regarding the United States Agency for International Development's contractor selection process and performance by that supply chain management company, Chemonics International, which was awarded the agency's largest ever monetary contract, a contract with a ceiling of $9.5 billion over 5 years. Congressional interest in this was triggered by reports last year that Chemonics had failed repeatedly to deliver essential health commodities in a timely manner to African and other countries where they are desperately needed. Most critically, antiretrovirals to treat HIV/AIDS patients. At its lowest point, only 7% of deliveries were made on time and in full. The purpose of this hearing is to determine where USAID went wrong in the selection and transition process of this contractor and what can be done to preclude such a failure in the future. In January of 2014, USAID issued a request for proposals for a supply chain management contractor that would consolidate procurement and delivery of health commodities to Africa and elsewhere, as well as provide health system strengthening in conjunction with the President's Emergency Plan for AIDS Relief, or PEPFAR. Two companies responded to the request, the first being the then existing contractor partnerships for supply chain management, and the second being Chemonics. In April of 2015, USAID awarded the contract to Chemonics, in large part because Chemonics displayed greater data visibility, or they purportedly did, and IT capability. As might be expected, the incumbent losing bidder filed a complaint against USAID with the U.S. Government Accountability Office, and upon losing that, lodged an appeal with the U.S. Court of Federal Claims. In both instances, a deferential standard of review is applied, and thus USAID's decision was upheld. Following the final decision, the partnership began this process to transition services to Chemonics. While tensions between the two companies were evident throughout the transition process, performance levels remained steady until after Chemonics fully took over the operations. At the end of 2016, under Chemonics' leadership, on-time deliveries dropped from 84% to 67%. They continued to free fall throughout 2016, down to 31%, and then reaching an all-time low of 7% in the first quarter of 2017. During this time, some countries reported stockouts of some of these life-saving commodities. This absolutely is unacceptable, and this unacceptable delivery record resulted in part from poor data quality, weak inventory management, and distribution practices and poor planning. However, while hindsight is 20/20, one cannot question what justified certain of the assumptions USAID made when it selected Chemonics. For example, USAID has graded Chemonics' data visibility as, quote, excellent, placing great reliance on Chemonics' promises regarding an IT system. No demonstration of a functioning IT system was ever requested by USAID during the selection process, however, nor in any in-person presentation during which the Technical Evaluation Committee could have asked questions. Indeed, no such demonstration could have taken place, as Chemonics had not even completed building the IT system that was specifically required in the request for the proposals. The system would not be fully functional until June of 2017, nearly a year and a half after Chemonics began operations. While USAID did require a corrective action plan from Chemonics and implemented some corrective measures on the company, including freezing promotions and raises until performance reached an acceptable level, It is the spur of congressional oversight, including visits into the field, which has forced the issue and brings us to where we are today, demanding answers and seeking viable solutions. Our oversight continues to raise questions, and not only with respect to the implementing partner, but also how PEPFAR and USAID are coordinating their activities. We need to know how it is that each year PEPFAR engages partner nations in developing country operation plans designed to meet particular needs in each nation while guaranteeing that annual taxpayer investments are maximally focused and traceable for impact. Yet USAID is still paying for the drug nevarapine to give to HIV patients in Africa. Nevarapine is an outdated drug with serious side effects that was supposed to have been retired long ago. This is an issue hopefully our witnesses can speak to and give us some insight into. I would also ask that our witnesses not only do a postmortem of what went wrong, but and speak to the mistakes that were made, but also provide us with solutions and a way forward, because I know both of you are completely committed to this, and we're very grateful that you took the time to be here to speak to us. If you could hold on 1 second. Okay, I'd like to now begin with our introduction of our witnesses, beginning with Ambassador Deborah Birx, who is a coordinator for the United States government activities to combat HIV/AIDS and U.S. Special Representative for Global Health Diplomacy. Over her 30-year career, she has focused on HIV/AIDS immunology, vaccine research, and global health. Ambassador Birx oversees the implementation of the U.S. President's Emergency Plan for AIDS Relief and all U.S. government engagement with the Global Fund to fight AIDS, tuberculosis, and malaria. In her role as U.S. Special Representative for Global Health Diplomacy, she works to align the U.S. government's diplomacy with foreign assistance programs that address global health challenges and move forward in achieving those goals, eliminating AIDS and preventable child and maternal deaths and combating infectious disease threats. This committee has worked very closely with the ambassador for years, and I laud her tremendous contributions to these life-saving interventions during her whole career, but especially as I've gotten to know her in the work here. Then we'll hear from Irene Cook, who is a Senior Deputy Assistant Administrator in USAID's Global Health Bureau. Previously, she was the Senior Infectious Disease Advisor for the Global Health Bureau and the Global Health Security Agenda led at USAID. From 2010 to 14, she was Director of the Health Office in USAID Indonesia, where she served as Health Attaché and PEPFAR Coordinator. During her 32-year career with USAID, Ms. Cook has also worked as a health advisor to the Policy Program and Coordination Bureau and as Chief of the Infectious Disease Division in the Global Health Bureau, helped start the President's Malaria Initiative, and served as chair of the Stop TB Coordinating Board. Ms. Cook has a Master's of Arts degree from George Washington University. I'd like, if I could, Madam Ambassador, if you could begin your testimony.
Thank you, Chairman Smith, and recognizing Ranking Member Abbas and other distinguished members of the subcommittee. I'm really deeply honored to be here before this subcommittee of the House Foreign Affairs Committee, mostly because of the amazing visionary support this committee has provided to PEPFAR since its inception. Today, more than 14 million men, women, and children are alive, and we have transformed the global HIV/AIDS pandemic because of the compassion and commitments of members of this subcommittee and the full committee, and also the bipartisan, bicameral support of your congressional colleagues. Under the leaderships of President Bush, President Obama, and President Trump, and of course, the generosity of the American people, we have made amazing progress. All Americans should be immensely proud of PEPFAR's achievements because they are their achievements. PEPFAR achievements have been made possible really for two very specific reasons. First, through our collective, unrelenting focus on outcomes and impact, and using data to improve all aspects of HIV prevention and treatment services. And secondly, Through our absolute commitment of using the best of each U.S. government agencies to achieve more each year through increased efficiencies and effectiveness. This month marks the 15th anniversary of PEPFAR's establishment. With strong bipartisan leadership, the U.S. government is not only saving lives, but we are accelerating our global impact and changing the very course of this pandemic. A principal factor in our success is we harness the latest science and data to direct resources where the HIV/AIDS pandemic is the largest, where the need is greatest, and then to ensure that the resources that are placed there are used as effectively as possible for the greatest impact of U.S. taxpayer dollars invested. Each quarter, we look rigorously at our outcomes and costs in order to continuously improve our work. This commitment to transparency and accountability and impact is why PEPFAR is often cited as one of the most effective and efficient U.S. foreign assistance programs in history. PEPFAR has invested billions towards building and supporting national health systems, including over $3 billion in the last 9 years for a strong, reliable, and secure supply chain. A high-performing supply chain is the lifeblood of our work. We must ensure that the right commodities reach the right people in the right places at the right time. This requires effective and efficient commodity forecasting, procurement, and delivery, including tracking every product all the way down to the site level where it's provided to the patient. PEPFAR has not only invested billions in strengthening supply chain, but also continues to provide ongoing technical assistance to governments and non-governmental supply chains, building infrastructure and funding hundreds of full-time U.S. government personnel in country and within governments. We are driven every day to bring the best medicines, the best diagnostics, and the best monitoring to every client we serve. After all this work that we have done together to bring the best, we are totally dependent on the last step. The supply chain must deliver, and deliver optimally every day, everywhere.
Ambassador Birx, if
Yes.
you wouldn't mind, there is a vote being called right now.
It's a perfect stopping point.
And so it seems rude as can be, and I apologize for it, but we'll take a brief recess for the vote. And my understanding is that several members will be coming back, including the ranking member. So, you know, your opening was outstanding, and you're only halfway through it, but maybe some of that could be reiterated again for the members when they do arrive, because it's so important. So we stand in brief recess pending the vote. The subcommittee will resume its sitting, and again, please accept my apologies for that extraordinarily long delay. You're very patient, and I thank you for that patience. We have been joined by both the ranking member, Karen Bass, but also our distinguished chairman, Ed Rice. So, chairman is recognized.
Chairman, and I also thank Ambassador Burks and Deputy Administrator of USAID, Irene Cook. Thank you very much for being with us today. And I would just mention how essential to our U.S. interests, how critical to our interests your work is, and I think it's also essential to the well-being of people around this planet, and certainly every American, because if you think through the consequences, that effort helps us combat deadly infectious diseases, certainly. And we think about Ebola and pandemic flu and the effort necessary to take those down in the early stages. And at the same time, these invisible enemies respect no boundaries, obviously. And they threaten not only people around this globe, they threaten our economic growth, our prosperity. So it advances global efforts to certainly eradicate polio and eradicate other debilitating diseases. And it promotes maternal and child health. It advances, as I said, U.S. economic interests, certainly our security interests. And I think it also helps grow stable societies. So I did want to go on the record here and say something about those efforts that buy us an awful lot of goodwill, and efforts, frankly, that have saved the lives of millions of men and women and children, and do so each and every year. The overwhelming majority of U.S. global health commodities, including for medicines and other products, are delivered through USAID Managed Procurement and Supply Management Contract, or PSM. And they deliver commodities in 56 countries. They provide related technical assistance to 40 countries. In January of 2016, USAID combined two prior PSM contracts into one with a 5-year, $9.5 billion ceiling, and this is the largest contract that USAID ever managed. Last fall, this committee began receiving reports of stockouts, and that's why the hearing today and why our oversight efforts. And those stockouts were of life-saving ARV drugs and bed nets that were meant to be delivered under the mega contract. So I'd just like to commend Chairman Smith here for his leadership and also Karen Bass, the ranking member of this committee, because in response, the investigation that was launched by our committee included a review of thousands of pages of contract agreements and guidelines and various orders and notifications. They conducted dozens of interviews with USAID, with CDC, with current and past supply chain managers and local implementing partners. Staff traveled to Uganda, I know, and to Ethiopia, and I know the members here traveled extensively on this. And wherever significant disruptions were reported, they met with USAID mission staff and local implementers, and even inspected warehouses and identified the challenges. And through this investigation, we've found that at the lowest point, the on-time in full delivery rates for life-saving HIV/AIDS medicines was a very shocking number. It was 7%, reportedly, while industry standards is around 70%. Delays were caused by mishaps at many stages of the process, from the contract awarding process to the transition between the contractors to delays in the implementation of new, supposedly highly regarded IT systems, to the performance of the contractor and the oversight of USAID and the Office of the Global AIDS Coordinator. And while delivery rates have improved and reports of stockouts have ceased, Concerns about what went wrong and why remain, and that's, again, why the focus here. So we continue our oversight of USAID and the Office of Global AIDS Coordinator to identify lessons learned and to ensure that these mistakes are not repeated. We recognize that Administrator Green and Ambassador Burt inherited this contract from the previous administration, and I applaud them for their dedication and rigorous work towards righting the situation here. In global health programs, no amount of mismanagement or waste can be tolerated because lives are literally on the line. So we've got to get it right, and I want to thank again Chairman Smith and Karen Bass for their efforts to get it right, and I thank you too for your efforts in this regard. And with that, I'd like to yield back, Mr. Chairman.
Thank you very much, Mr. Chairman, and thank you for your ongoing work on this important. I mean, oversight is a very important part of our work, and you certainly have done an outstanding job. So thank you.
Thank you.
I'd like to now yield to our distinguished ranking member, Ms. Bass.
Well, thank you, Mr. Chair and Mr. Chair, for your leadership on this issue and for holding today's hearing. This is one of those cases where we get to see how U.S. government programs are working abroad. And from what we have here in Congress, there have clearly been some challenges. I look forward to hearing from the witnesses how these challenges have been addressed. In August 2017, news reporting revealed that $9.5 billion in the global health supply chain funded by USAID was failing to deliver an acceptable percentage of its shipments on time and in full. Not long after that article, members of Congress started to get calls from various groups reporting that antiretroviral medications were not available. Imagine our disbelief when people were reporting low levels of medication or complete stockouts, when we here in Congress knew that the money was available. While Chemonics International, the project implementer, has acknowledged that there were challenges and described steps the company has taken to improve performance, it's important to reflect on the fact that the project coordinates a global health supply chain for commodities such as HIV tests and treatments. And I understand that there has been some rectification of the situation, but I guess for me, and what I really would like to understand, how a company as big as that has been in the business as long as this, got into this problem in the first place. And I do think that it takes a lot of courage for someone to take that first step if you potentially have HIV to get tested. But imagine hearing that the test or the medications are not available. The same holds true for malaria drugs. So this supply chain supports the U.S. government's largest and most important global health initiatives, including the PEPFAR, the President's Malaria Initiative, and population and reproductive health programs. I'm very concerned that after 15 years into PEPFAR, we're having to have a hearing to address low performance and other problems with the supply chain project that coordinates life-saving commodities. Needless to say, this raises serious concerns here in Congress. Our role, of course, is oversight, and it's to see how that money is being spent and to ensure that the contractor is performing adequately, but more importantly, PEPFAR, the President's Malaria Initiative, and other U.S.-led global health programs save millions of lives. What we want to do here is understand what happened in order to make sure that it doesn't ever happen again. And, you know, in addition to mentioning that, I know that there has been some rectification of this. I want to understand, just in the contracting process, if I'm a company and I don't deliver, am I still getting paid? I would like to understand that. And if so, you know, what kind of accounting, what kind of records? How does this happen that the company actually doesn't raise alarm to say we're having difficulty, you know, such a small percentage of what we're supposed to deliver is being delivered, we're not getting paid, we need the money. It would be deeply disturbing to think that we're not delivering the product, but we are still getting paid. I yield back.
Thank you, Ranking Member Bass. Mr. Garrett?
Thank you, Mr. Chairman. As a precursor to the comments of the distinguished panel, I would submit that mismanagement and waste in global health programs transcends even that which was very astutely and accurately pointed out by my colleague and chairman of the full committee, Congressman Royce. He said global health programs matters so much because mismanagement and waste actually costs human lives, and he's absolutely correct. However, the other thing that mismanagement and waste does is creates a paradigm wherein those people in this body, which under Article 1 of the United States Constitution is responsible for creating budgets, makes it really hard for us to tell the taxpayers that we're doing our job well. And I have not a long history because I've only been here for 16 months, but a pretty daggone outspoken history of advocating on behalf of foreign aid and expenditures. So I support foreign aid and expenditures, but I can't support waste, which is why this hearing is so important. And Congresswoman Bass said accurately, and I again commend her, because one of the neat things about foreign affairs is we actually get to be bipartisan here, that our role is oversight. Absolutely true, but our role is oversight and the responsible stewardship and allocation of tax dollars taken from working Americans. Now, am I advocating against these efforts? Absolutely not. In fact, while I could think of many things to say about, for example, the George W. Bush administration, some good and some bad, during my small amount of time on the African continent, I heard a lot of glowing reviews by virtue of this nation's investment in Africa, in humanitarian aid, and specifically in HIV and AIDS. And these are good things because what they do is they create a vision of the world that's different from that which they see from Hollywood, which is philanderers, car chases, and drug-related shootouts, right? So we can do good, but the oversight element is so important because the fiscal conservatives want to cut where they can, and I understand that. And if I can't say we're being good stewards of these funds, how can I justify the continued expenditure? And because I genuinely believe, not only as a member of Congress, but as someone who wore the uniform of the United States military, that if we can create a view by the individuals in the emerging world particularly of the United States as a benevolent partner as opposed to a dictatorial hegemonic power, then better things will happen and more lives will be saved. So I commend the subcommittee chairman, my colleagues, Ms. Bass and Mr. Royce, on their absolutely spot-on words. I'd just take it a step farther and say we have and we have a responsibility to be good stewards, and in order for us to be able to sell, if you will, the idea that foreign aid matters and works, we got to get this right. So thank you, and I'd yield back.
Thank you very much. And Ambassador Burks, if you wouldn't mind starting from the top, because we really want to hear what you got to say.
Thank you, Chairman Smith, and it's a privilege to be here with Ranking Member Bass. We spent some time together in Malawi and Kenya and really had an extraordinary trip, and I really want to recognize Chairman Royce for the support that he has given to PEPFAR. I also want to recognize the staff because the dialogue that we constantly have with your staff has made the program stronger. So in answering, and just to note, I also active duty military for 29 years and appreciate deeply your comments because that's what this is about. This is about the translation of the generosity and the commitment of the American people to envision a better world for everyone. And to be part of that has been a true privilege. Today, more than 14 million men, women, and children are alive, and their lives have been transformed because of HIV/AIDS response from the U.S. government, really because of the compassion and commitment of the American people and the people of this subcommittee, the main committee, and the bipartisan, bicameral support that we have had for the 15 years of PEPFAR. We've also had administration support from President Bush to President Trump and President Obama in between, really continuous support across the aisle for this important program. Why? Because we've been focused on impact and results and transparency and accountability to really ensure that every dollar that the U.S. taxpayer entrusts with us is spent effectively and efficiently. PEPFAR's accomplishments have been possible for two fundamental reasons. One, we are unrelenting in our data analysis and ensuring that we understand what's happening at the sites where the clients are being served. Secondly, an absolute commitment to utilize a whole-of-government approach, utilizing the best of each U.S. government agency to achieve more each year through more effectiveness and efficiency. Today, and indeed in a couple hours across in Dirksen, we recognize the 15th anniversary of the PEPFAR establishment by Congress from State of the Union of President Bush in January. This bipartisan leadership is not only saving lives, but now we know we're changing the very course of this pandemic. Principal factor in our success is we're harnessing the latest data and the latest science and directing those resources where the HIV epidemic is the largest, the need is greatest, and then ensuring those resources are effectively and efficiently spent so that we have the maximum impact for each dollar investment. We look at this data carefully every quarter, looking at outcomes and costs, and in order to continuously improve our work. This commitment to transparency and accountability and impact is why PEPFAR is often cited as one of the most effective and efficient U.S. foreign assistance programs in history, but importantly, is transforming lives around the world, as you have witnessed in Africa. PEPFAR has invested billions into the health systems, including over $3 billion to a strong, reliable, and secure supply chain. As Representative Bass just mentioned, how is this happening 15 years in with these large investments? A high-performing supply chain is the lifeblood of our work. We must ensure that the right commodities reach the right people in the right places at the right time. This requires efficient and effective commodity forecasting, procurement and delivery, and tracking every product down to the site where the client needs the medications or the diagnosis. PEPFAR has not only invested billions in strengthening this supply chain, but continues to provide technical assistance to governments and non-governmental supply chains, building infrastructure, funding hundreds of full-time U.S. government personnel in country and within governments. We're driven every day to bring the best medicines and the best diagnostics and the best monitoring to every client we serve. All of this work to bring the best is totally dependent on the last step, ensuring that the supply chain is functional at every aspect down to the clients we serve. So I have been deeply concerned about the recent supply chain challenges that bring us here today. Some of the issues have been fixed and markedly improved. Others still need to be urgently addressed, and some of them have been urgently addressed just in the last week, including the nevirapine issue. Everyone who's involved in the supply chain at all levels must feel that same sense of accountability to get our successful drugs and medications to the levels that they need everywhere along the chain. We need it to successfully and sustainably deliver these essential life-saving treatments and commodities for mothers, fathers, sisters, brothers, sons, and daughters that we have all been privileged to serve for the last 15 years, because they deserve nothing more than our best, and we can and must do better. That is why I have strengthened the State Department's oversight of all PEPFAR-supported commodities. This includes monthly antiviral risk reporting, increased oversight of the Emergency Commodity Fund use and expenditures, approval over all procurements of any legacy ARVs that are no longer considered first line, and critically sharing the commodities-related data between PEPFAR, USAID, and the Global Fund. Late deliveries have consequences. No one wants to be down to their last test kit when a pregnant mother walks through the door and needs to be tested. So every clinic, every district hospital, and every community site begins to slow down services when they have concern about arrival of commodities and drugs. People are turned away and services is not delivered when people are concerned about stocks. Together we are closer than ever to controlling this pandemic and decreasing the future costs because of effective and focused programming. What once seemed impossible is now possible. Controlling and ultimately ending the AIDS epidemic is a public health threat for all of us around the globe. But this will only happen if we constantly hold ourselves accountable to not only do more, but to do it better. We all need to be at our best every day, and everyone as part of PEPFAR needs to be at their best. And every contract needs to deliver its best every day. Chairman Smith, Ranking Chairman Bass, and the other distinguished members of this subcommittee, thank you for this opportunity to hear from each of you today. Thank you for your continued support, your staff support, and we are once profoundly grateful for the work that you have done to ensure PEPFAR is successful every day. I look forward to your questions.
Dr. Hirsch, thank you very much. Ms. Cook.
Thank you very much. Thank you, Chairman Smith, Ranking Member Bass, distinguished members of this committee, and I'd also like to thank Chairman Royce for joining us here today. And I want to thank you very much for the very strong support and leadership you provided to the work the U.S. government does in global health. I'd also like to thank you for the oversight role that this committee plays, and again, echoed Ambassador Birx's thanks to not only to you, but also to the staff for the engagement over these last many months, and we very much appreciate that. And I do appreciate this opportunity to discuss USAID's work in supply chain management and commodity procurement, to talk about the procurement process we used, provide an update on the performance of the contract, and share our plans for the path forward. For decades, USAID has been a world leader in providing essential life-saving commodities for public health programs. We manage global health commodity procurement and delivery on behalf of the interagency PEPFAR and the U.S. President's Malaria Initiative, or PMI, and many of USAID's global health programs. For example, this work has helped keep the 14 million patients on antiretroviral therapy that Ambassador Brooks mentioned, and delivers malaria prevention, treatment, and control commodities that benefit over 500 million people across Africa. The success of the U.S. government's global health programs has depended on our investments to ensure the availability of health products in the countries where we work. Previously, USAID's procurement and supply chain operations were managed under 2 large contracts, one for HIV and one for other health programs, including PMI. In 2012, we began the process to design a follow-on program seeking to incorporate lessons we had learned from the predecessor projects, increase efficiencies, and continue to identify cost savings. We solicited input from headquarters and field staff, from the Office of the Global AIDS Coordinator, from PMI, from the Centers for Disease Control and Prevention, and other partners. We commissioned an independent expert review of existing supply chain models to ensure we applied state-of-the-art and commercial sector supply chain best practices. Because of the heavy management burden in the field and to prevent or minimize duplication of systems, we made the decision to consolidate procurement and supply chain function into one large award rather than 2. We recognized that any transition of this size carried risks. We took steps to mitigate the risk of supply interruptions and stockouts by increasing inventories and ensuring overlap between the prior contracts and the new contracts, all in order to ensure that patient access to commodities would continue smoothly. Based on the extensive evaluation of the proposals by a review panel, which include USAID and Office of the Global AIDS Coordinator staff, USAID awarded the contract in April 2015 to a 12-member consortium led by Chemonics International. This consortium includes world leaders in supply chain, including IBM and Kuehne + Nagel. Work began in January 2016 after a protest to the GAO and claimed the Court of Federal Claims were decided in USAID's favor. The contract faced management challenges in the initial months and had poor performance in its on-time delivery. USAID staff identified these performance issues very early in the process. In Washington and in the field, we have worked to minimize the impact of late deliveries, including assisting in the redistribution of commodities between facilities to prevent stockouts. We have also held the contractor accountable. In response to USAID's demands for improvements in April 2017, Chemonics developed and implemented an action plan to address its deficiencies. As a result, we have indeed seen significant improvement in their overall on-time performance, delivery and performance. The most recent data show that on-time delivery increased from 31% to 73% over the past 6 months. On-time in full delivery also improved from 32% to 67% over that same period. The backlog of undelivered orders is now under 5% of total shipments, an industry standard. While these improvements have been sustained even as order volume has increased, progress must continue. Performance has not yet met the target for on-time delivery, and USAID continues to provide a high level of oversight and scrutiny over this contract to hold Chemonics accountable. We have started to aggressively apply lessons learned from this experience to the design of the USAID's next supply chain programs. Building on USAID's broader procurement reform efforts, we are identifying ways to be innovative in our design, procurement, and management of awards and effectively manage risk. We will actively engage industry leaders, interagency partners, and the field throughout this process. We will also build in opportunities for public comment during the design process and closely consult with this committee and our other oversight committees. USAID's highest priority is to ensure that patients can access critical health products that prevent and treat life-threatening disease and that there is no interruption in treatment. We take our obligation to ensure good stewardship of taxpayer resources very seriously. Thank you for your attention to this very important issue, and I look forward to answering your questions.
Thank you. First of all, let me thank both of you for being your integrity is so high and so your commitment so deep. You know, I've been here long enough to know that when something goes awry, as it does like this, that there's, cover up might be too strong of a word, but there's shift blame, never come fully forward with facts and documentation, but you have done precisely the opposite. I know Ambassador Birx and I have had numerous conversations about this, and it's all about making sure, and you are so data-driven, but you are equally, if not more so, compassionate, and you want to ensure that the person who needs that ARV or whatever the drug or the intervention might be gets it on time so he or she do not become sicker or even worse. Now, have there been consequences where anyone has, as far as we know, potentially lost their lives, or was the stock, that was there sufficiently available that it didn't get down to the very last one and then they're on zero? That would be my first question. And again, I can't say it enough. You have looked to fully expose, explain, explore, and now aggressively remedy a situation that for the victims of HIV/AIDS and other diseases over which you have jurisdiction could be deleteriously affected, if not lead to their death. So that would be the first question. Second, I would ask, when USAID issued the request for proposals in January of 2014, USAID convened a technical evaluation committee to evaluate bids. Was OGAC part of that or not? And let me also ask, with regards to the country operational plan, the COP process, can you explain that to the committee, how it relates to the distribution of ARVs and the efforts of USAID and Chemonics to engage in health system strengthening? If you could get to the issue of nevirapine and explain that fully as to what are the side effects, what are the problems associated with it, and what is USAID and PEPFAR doing to move to other drugs like DTG? Maybe you could explain that and give us some good insights into that. Let me finally ask, and I do have others, but I'll go to my colleagues. When Chemonics did not complete the first phase of its IT system, ARTMIS, until August of 2016, with the final phase not being completed until the end of June 2017, this is despite the fact that the new system was promised in the contract. So they represented, obviously, that they had that capacity when they didn't. And I'm wondering why it was not caught that there was a lack of an IT system when the awarding of the bid occurred. And again, we might talk about the corrective actions that are being taken now to ensure that never happens again. And my understanding is that some of the top team, if not all of it, of Chemonics have been fired. If you could speak to the accountability side of all of this, both on Chemonics as well as on the government side, because obviously accountability, holding people to account for when they do something that has such a potentially catastrophic consequence. I liked what you said. Late delivery has consequences, and so it ought to have consequences. So those who, either through incompetence or whatever, don't do it again. And I just a thought, and maybe there's nothing to this, but I'm hoping there was no revolving door involved with Chemonics getting it or any of that. If you could give us some insights into, the technical team that did the awarding, was that completely above board and they just missed it, or could there have been something more nefarious?
Right. Well, perhaps I can start and then ask Ambassador Birx to fill in, particularly on the drug and some of the other issues. And thank you very much, Chairman Smith, for your questions, and again for your very close attention to this hugely important issue. I really, really do appreciate that. Your first question regarding whether there have been instances of people not having the drug or losing their lives. This is an issue that is of great concern. And as I mentioned, we knew there would be disruption regardless of who won the contract. So we took steps, as I mentioned, to build in buffer stock and to make sure we had additional overlap. And this is also something we've been looking at very, very closely and working with our field staff and asking them to work with their country counterparts to monitor and make sure that doesn't happen. We're aware of 2 cases where delays in deliveries did have programmatic impact. One was with a bednet campaign in Nigeria, where the nets were delayed in arrival, so it delayed the start of the bednet campaign for some weeks, as I understand it. And then also in Ukraine, where the delays of the shipment of ARVs did delay onset of treatment by a couple of weeks for some patients. And those are the two instances that we're aware of. It is something we continue to investigate and ask our field staff to regularly let us know of any issues. Stockouts do happen in the countries we work, right? And that's part of where the technical assistance that we do, we tries to make sure that the country systems are working to make sure managed supplies, make sure that that last mile facility does have the medicines they need to deliver. So that is something we constantly look at, but those are the two instances. So with regards to the technical evaluation panel, and I believe and I hope this is something we've shared and we can certainly share it again, the panel did include a representative from the Office of the Global AIDS Coordinator. It was something that was set up some years ago. As you said, it was a long, very long process, but it also included across the board expertise not only in supply chain, but people with HIV experience and maternal child health and family planning and malaria experience, and we really tried to make sure that the panel reflected the full range of expertise, as well as on IT systems and on logistics systems and everything that we were asking for in the solicitation. I was not part of that panel, so I can't speak to any further details, but we can certainly share with you additional information on that. On that, let me just jump to one of your later questions. We took extraordinarily, we always take very careful precautions to make sure that the procurement and the review of those of proposals is done according to the rules, according to the federal acquisition regulations, and is tightly controlled. And with this one, because it was so large and so so competitive, we made sure that there was no issues whatsoever with the process, and was very, very tightly controlled, tight oversight by USAID. The panel was completely sequestered for the many months. No one was aware of who was on the panel, because that's part of the rules, is you're not supposed to know who's sitting on the panel. But they took very, very careful steps to make sure there was full protection and no conflict of interest with the members of the panel and the decisions that were made. And that was also part of the overall review process, both within USAID.
Just on that point, if I could, the IT assessment, who did that? And
so there were, as I understand, there was a member on the panel, was a expert on IT systems, as I understand, or that expertise existed on the panel. What we asked for in the RFP was to show us what your approach to putting an IT system, and it was one of the criteria. It was not necessarily the first criteria, but it was among those criteria. What the proposal was, the Chemonics did have components of that system in place already. What hadn't happened yet was the knitting all those pieces together, and that needed to happen once the contract was awarded, as they can make sure it was being responsive to the procurement and supply delivery, which was what the system was meant to do. So the startup of that system was a few months late in starting, and that was one of the issues we raised with Chemonics in April of 2017. It is now up and running, and we continue to adapt it, and which is one of the other things we asked for, is a system that could be flexible and adaptive to whatever we needed it to do, or whatever the system needed it to do, and that is certainly what it has been underway. The proposal, or the RFP, and we can share those criteria with you if you like, because I don't have them all in front of me at the moment, but did ask to propose their approach to putting the system in place. And it was one on that basis that Chemonics' proposal was reviewed. Let me talk briefly about system strengthening. It is, I think Ambassador Burks mentioned this, and we certainly has been the trying to build logistics and product delivery systems in the country where work has been a critical function of our work in supply chain since the very, very beginning days of our procurement and supply chain. It's been about, it's a relatively smaller portion of the overall money we put into procurement and supply chain. It's roughly about 15% of the total funding. And it has had impact. I mean, we work through country systems, and our intent is to build the capacity of the systems within the country we work to procure and deliver supplies themselves. The PSM project's role is to bring commodities to the central warehouse, and then What we want is the country system to take it from that warehouse to make sure it gets to all the facilities and that there are not stockouts. So the technical assistance and the work we do is meant to improve those systems. So there has been tremendous progress in that, and it is country by country, and there is wide variability from one country to another over this years. A good example is Zambia, where we started working in Zambia in the late 1980s, where it was very poor system, not with products shipped out whether or not it was needed or not, or paying not a whole lot of attention to whether there were stockouts. But over the years have helped build, the Zambians build a system that has a network of warehouses that is using high technology to make sure product is getting where it needs to go and is a high-functioning system. So it does make changes. And this is a system that started with just a few products, but then was able to take on all of the product of the PEPFAR as well as PMI over the years. So there certainly is progress there. Let me maybe turn to Ambassador Birx for the questions on nevirapine and TLD, and I can add on the supply chain after she answers that.
Great, thank you. So just a couple of comments. I was not at OGAC when the Technical Review Committee was meeting, so I know CDC. I was at CDC at the time, and so we had awareness that USAID was letting an RFP for a combined agreement, and that was the depth of our awareness. When I came to OGAC, I found out about the award through the public system when it was announced publicly. But I think there were procurement concerns and I guess other concerns, so we were not aware of the award until it was announced publicly. That said, I think this whole issue of supply chain, and thank you for the hearing, because it's really asked us to step back, to really say, like Congresswoman Bass said, why 15 years in are we talking about glitches in the system? Not just glitches at the central warehouse where Commodix is responsible. And the perception that the commodities are not there when they're supposed to be sends a ripple effect down through the system. And people will adjust so that they don't have stockouts. They will adjust to giving clients 2 weeks supply. They will adjust to giving them 1 month supply. There is a good communication between the system, and so whenever there's a concern that something will be late, people adjust so that clients don't actually miss out on their medication. And so a lot of those adjustments have been happening. And so we will find out that clients that are supposed to get 3 months supply are only getting a 2-month supply. And that requires them to come back then multiple times in a month. And those are the things that that often is at the transmission from the warehouse to the site. And so we really need to look at these $3 billion that we've invested just since 2009 and say, are we investing correctly with technical assistance to really create a system that has the resilience to meet the demands of the future? Because with that level of investment over this amount of time, we would have a different expectation. When you look at the laboratory systems and how far they have come, when you looked at task shifting within the health cadres and how we've learned nurses to do what doctors have done and community health workers to do what nurses have done. When we've seen all the progress we've made in other areas to allow 14 million people to be on treatment, when you talk to the Global Fund, when you talk to the field, the one comment that continues to come up is the integrity of the supply chain. So there is an issue there that persists despite a significant investment. And so we're looking at all aspects of this. Maybe our conceptual framework about how to support a supply chain may be old school, and maybe we have to look at this differently. We are working with USAID on each of those issues. At the same time, we've been trying to streamline what we ask for. So as we move to viral load to save money, we've taken out CD4 counts because it's no longer needed. So that simplifies the supply chain of who needs what when. We're also trying to simplify to a single first line and a common second line so that countries can move supplies as described between warehouses and between sites because the clients are on the same thing. And I think most importantly, if you go to pepfar.gov today, you will see our results down to the site level and the targets at the site level, as you described about the country operational plans. And so any supplier should be able to look at that and know precisely what the needs are at that site over the next 12 months to create forecasting, procurement, and delivery. And so this is now publicly available, open to everyone, including the people on the ground, so that they can assure that they have access to the same data that we have. And I think the nevirapine issue is a real illustration how Administrator Green and Chief of Staff Bill Steiger and Irene have worked with this. When we found out just 3 months ago that we were still utilizing nevirapine-based products, what does that mean? That means that was a product that was created in the mid-2000s. Often children were put on this combination nevirapine-based product. The interesting piece of it, we were asking the question, why aren't young adults virally suppressed? We've been putting these surveys in the field at the community level, and we have found whereas adults over 25 were about 90% virally suppressed. If you were between 15 and 24, your viral suppression was around 60 to 70%. We couldn't understand it. If some of those clients have been on nevirapine since childhood and kept on a nevirapine-based product, we know they're more likely to have resistance. And so the team at USAID and the team at OGAC have been working very hard to actually cancel orders. Now you might say, how does this happen? Well, countries request, ministries of health request, partners were requesting these drugs. But this awareness has really increased our awareness and allowed us to find this legacy ordering. And they've already been able to cancel orders with no cost so that we can move to a more effective regimen for adolescents and young adults. I think we should be very proud that out of this hearing and out of the COP development process and this change to this new drug that you mentioned, the TLD-based, TLD drug that's based on TDG, dolutegravir, that has really brought out all of the issues about what drugs we're utilizing. And the Global Fund really much relies on the US government to really, because we have the boots on the ground, to work with governments and communities to ensure that the best drugs are being ordered. And so now we've really in the last just 3 months, so what often would have taken us a year to fix, we're now fixing in a matter of weeks. And I think this level of oversight translating down to our more constant awareness of what is occurring. And we've put in a lot of checks and balances at the State Department to ensure that we are aware of all the aspects of the functioning of the supply chain. But we still have substantial work to do between the warehouse and the clinic. Because we have spent, if you remember, you all have done so much work with us and FDA to ensure that a new drug, a branded drug, that is highly effective in the United States or Europe is immediately worked on licensure agreements to take them to generics and to get waived through their expedited FDA approval process. And that's allowed us to move the best drugs to the countries immediately so that they can take advantage of all of our scientific advances. That movement and that rapidness has allowed us to really look at our procurement processes and really find where we are still having these gaps. And then we really need, at each one of these gaps as described, have a solution where we quarterly monitor our improvement. We want to take the same thing that we've taken to the clinic on ensuring that clients are doing well by looking at their viral load suppression, to have that same level of data out of the supply chain so we can really monitor stocks as they move to the clinics where they're needed. That will allow us to decrease expiries and also to ensure that there is agreement between what partners report on people on treatment and what drugs are being utilized at the site. So it's a double check to ensure that there's validity and validation of all aspects of the program.
Thank you, Member Bass.
Thank you very much. Thank you for your testimony. So I still would like to understand the process. Chemonics, I was looking on their website while you were speaking. There's not a ton of information there. It's not clear to me if it's an NGO or a for-profit, who runs it, who owns it. None of that is clear. Maybe you have the answers. And then in the contracting process, you give a contract out. It sounded like Dr. Bricks, it sounded like USAID does an awful lot of the work. from what you were describing, and so I thought that's what the contractor did, a lot of what you were describing. So how do these contracts work? Is it cost reimbursement? They deliver, you pay? This is a $9 billion contract, right? It was $3 billion since '97. That's a heck of a lot of money.
So thank you very much, Representative Bass. So the $9 billion is a ceiling for over the 8 years of the contract. So it's not, we haven't given that money to Chemonics as yet, but it's a ceiling for contract. I will have to confirm of whether it's what's the type of contract, whether it is a
For-profit or not-for-profit?
That, I believe Chemonics is for-profit, but I don't know. We don't award contracts based on what the institution is per se. We award contracts based on how their proposals meet the criteria, which does indeed include past performance as an important component of that.
Well, it is also important if it's a for-profit, because if it's a for-profit, they're going to look, obviously, what their bottom line is, and so how do they make money?
Absolutely.
How do they earn a profit off of taxpayer dollars delivering services that they don't provide?
Well, the issues with Chemonics performance was about the on-time delivery. They did indeed deliver the product. They just did it late for those first few, and not on time with a fairly narrow window.
So what is late?
Late is the way we describe or define on-time delivery is within a 21-day period. So 2 weeks before a date and 1 week after is when we expect the product to be delivered. I would note that that's a narrower window than the predecessor contracts had, which was much longer. So we are holding them to a higher level of accountability than previously.
Some medications, it's difficult to be interrupted in your therapy by late.
Well, when you do a procurement, when countries do procurement orders, you know, you do it, you plan for when the drugs need to be there. So the date for procurement shouldn't be the day you're about to stock out, right? You need to have enough timing and plan, as Ambassador Burks was talking about, through the system to make sure product can get through the system to where it is. So this is product going to the central warehouse.
So when did you find out, and I don't mean you personally, of course, that they were having a problem?
So our staff identified the problem fairly early on. It was probably in August 2016 that they identified there were some issues.
And how long had the problem been going on?
Well, that was at about the time that Chemonics started. That was when Chemonics first started doing the purchase and did their first purchase and started the delivery process. We had an overlap between the two contracts for a number of months, and it was very early on that our staff identified that problem. And they raised it, and there was some attempts to fix it, and they continued to escalate the issue all the way through until we sent a formal letter to the head of Chemonics in April 2017.
So your staff identified it?
That's correct.
As opposed to the contractor saying, I'm having problems finishing my contract?
There was a lot of discussion back and forth. I can't speak to exactly what those discussions were. I believe the contractor did identify that there were also issues and did try to address it. I'd have to come back to you on exactly what those discussions were and what those issues were.
And so what penalty did they receive for being late?
There were a number of corrective actions. We gave them, you know, as per a question Chairman Smith asked, they implemented an action plan, and they replaced all of their most of their senior staff. So many of those senior staff were removed and replaced by others.
And that's a correction plan.
That was part of a correction plan. In addition, as part of our process, we do ratings of the contractors we have. They received a negative rating, which affects any other business they're likely to get from the federal government, because you look at those as part of your past performance. So that would certainly affect.
But their contract's not stopped. Their
contract is not stopped, right? Because they did continue to deliver the product. They were just not meeting the on-time delivery metric.
And so when they're late, is there a financial penalty that they pay for being late?
There is not a financial penalty that I'm aware of in the contract, but I'd have to confirm that. But they did deliver the product. They did purchase and deliver the product. They did not meet the on-time delivery metric. We also put a moratorium on any raises on the contract staff and refused to allow them to make any raises. And as part of our corrective action plan that they proposed and we accepted and they completed, there were a number of other things. They accelerated the MIS system that we talked about a few minutes ago, and they made some changes and simplified and straightened out their systems and their management systems.
And I believe that you said that now they're about at 60%, did you say?
They are overall 73% on-time delivery, yes.
So 20+% is still late.
Well, the target is 80%.
Oh, the target's not 100%?
No, it's not 100% because there's always things, and I think industry standards is much lower than that, but our target is 80% on-time delivery
And
within that 21-day window.
I ask you these questions because I'm just really trying to understand what processes we use. And I think like my colleagues, Mr. Garrett was mentioning, this is a tremendous amount of money. And in the normal course of doing business, you can't, I mean, it's one thing to be late if you're delivering shoes. It's another thing to be late if you're delivering life-saving medication where you can't have interruptions. And I know you said that the countries account for, it's not like they run out completely, but I don't know that. And I would ask if you do, because if you're 21 days late, some of the countries have 30, 40, 50-day supplies. I would just question that.
So as
some of the places.
Yeah, no, and it is something we're very concerned about and constantly monitor to make sure there are not issues with stockouts, because that is the most critical piece here, is making sure patients have access to the drugs when they need them, whether that be for malaria, for HIV, AIDS, et cetera, that there is no interruption in treatment. So we do our teams on the ground, which is a combination both of the contractor teams as well as our U.S. government staff, work very closely to make sure that orders are put in place in a time to make sure there is no interruption. So it is all part of a fairly complex process to make sure you're doing the orders on time and that when the orders do come in, they meet that, and you can send the supplies down all the way down to the facilities because they have to go through the systems in country.
So there was a challenge to this contract.
That's correct.
And why was there a challenge? I mean, I read that there was one. It went to court and it didn't hold, but I didn't understand why there was a challenge.
So it is not uncommon when there is another bidder to challenge the decision. The losing bidder would do so. So the losing bidder did challenge it through the General Accountability Office, which reviewed the challenge and reviewed a challenge against all of the documentation that we made about our decision, and found and concurred with our decision and found in favor of USAID. Then they raised a claim with the Court of Federal Claims, who also found in favor of USAID and dismissed the challenge.
So it's a slightly different subject. Recently there have been tariffs that were imposed on products from China. And there's 1,300 products that are on that list. And some of those products are rapid diagnostic tests for malaria, vaccines, and other critical compounds. Does that impact any of what, since part of this contract was malaria drugs as well, correct?
Yes, malaria drugs are certainly part of the contract, yeah. So I don't have any information on that. I'd have to get back to you, and we could investigate and get back to you on that question.
Okay, one of the big things I really would like for you to get back to me on is the question as to whether or not this is a for-profit company, whether the company is still paid by being late, which is an interesting thing. I think in a lot of businesses, you don't just continue getting paid if you don't fulfill your objectives, even if you are. The product eventually gets there, it's just late. It doesn't sound like there's any financial penalty at all. And how do companies that are for-profit make a profit in this way? You know what I mean? These are taxpayer dollars, so if I sell less or cheaper or inferior products, I increase my bottom line. How do you work with for-profit companies in this space?
I'd be happy to share some information about that, both about Carbonics and the structure of the contract and those issues, and we'll share that with you after. I don't have that information with me now, but would certainly be happy to do so.
And just in closing, Mr. Chair, again, I raise these questions because I think that they are questions that are bigger than just this contract. It's about how USAID does business, period. When my colleague over there is concerned about waste, it depends on how you look at waste. And so, anyway, I ask these questions because I just question how we do business sometimes. Thank you.
Mr. Garrett.
Thank you, Mr. Chairman, and thanks to Ranking Member Bass. I think there's a little synergy here. And I want to preface my questions and comments with this caveat, and that is that I am not targeting you ladies, although it may sound like it. But there's some frustration here. It's over a $9 billion contract. I'd just like to break that down for folks in my district. That's $9,000. And the waste is mind-numbing. So, Ms. Cook, you indicated that in August 2016, your staff identified the problem. Is that correct?
Yes, sir. Or
Okay, but
to identify it, yes.
the on-time in full delivery in August 2016, based on the data that we've received, was probably somewhere in the 50% range, and that was near the beginning of this contract, correct?
In August 2016, our staff started to identify some issues because a lot of these issues were about the management and how the contractor was working to manage the process.
Is it correct, though, that the on-time in full delivery around August 2016, based on the data you've provided to this committee today, would have been in the ballpark of 50% plus or minus 10?
we're
not gonna, but that sounds about right based on the data that's in front of me. Okay, and so it's also correct then that the trend of on-time in full delivery continued downward from that point, let's say roughly 50%, to a low for an entire quarter of a year of 7% in the January through March quarter of 2017. Is that correct?
That's correct.
Okay, so you identified the problem in August, and then January through March, the problem had exponentially increased. Accurately depicted? So then you indicated that you sent a letter to Germanics in April of 2017. Okay, with all due respect, and again, you're not the target here, but what took us so long?
Sir, thank you, sir. Let me describe a little bit of the process. So in August of 2016, that was when Germanics first placed their first order. And at the time, our staff identified that there were likely to be some issues. They hadn't yet made those deliveries at that time. The first delivery, because there is a long lead time for many of the products we do, you don't necessarily send an order and have the order delivered the following week. There's typically several months in between the lead time between the order and the delivery.
But the contract initiated in July of 16, and we identified weaknesses and a delay in on-time in full delivery in August of 16, a month later, which continued precipitously downward through the first quarter of 2017, and then in April we sent a letter. Is that accurate? Again, I'm not after you. I want to understand what happened.
No, I appreciate that, sir. So the Germanics began the ordering delivery in August of 2016.
And we immediately identified a shortcoming in Germanics' performance as it related to that 80% goal of on-time and full delivery. Immediately.
We identified there were some issues within their
I'm not trying to be short with you,
No,
but this
sir.
is sort of yes or no stuff.
Yes. We identified issues with it. They had not yet delivered any product at that moment in time. So when we continued to escalate the issues within Germanics, our staff identified the problem. They did some reorganization. It didn't fix the problems. Indeed, as you noted, the lowest point was 7% in that first quarter of 2017.
And that was for an entire quarter. Again, I'm not trying to interrupt you, but it wasn't 7% for a day. It was 7% over a 3-month period.
That's correct. That's correct. And that rate, exactly, our reaction was similar to yours. We were very, very concerned. So continue to escalate the problem.
So help me help you here, because I think we want to get the same thing, which is, and let me just digress for a moment. So many times in government, and I've worked in local government, I've worked in state government, I've worked in federal government, and you guys, to your credit, at one point I heard something to this end a little bit. It's a funding problem. Well, if you're at 7%, then I suppose you could increase your expenditures by 14.2-fold and get to the aspirational 100%, but when you're $21 trillion in debt, right? And I support this program, and earlier, Dr. Burks, you suggested that PEPFAR works, and I would submit that we know PEPFAR works. There are 14 million living, breathing, walking pieces of evidence that PEPFAR works, 2.2 million children born without HIV that attest to the fact that PEPFAR works. But how do I tell my colleagues that this is a good expenditure when we're at 7% for a quarter? I'm just getting warmed up, though. So I'm here to support the program, but how can I support a program that throws proverbially bad money after good? All right, so we identified within a month of beginning the contract with Germanics a shortcoming in the OTIF, the on-time and full delivery. Then in April, we sent a letter. Okay, then we're going to move forward. Germanics on-time and full delivery was 31% October to December of 16, dropped to 7% January to March of 16. We've seen an upward increase. You've addressed this problem. I'm satisfied with your comments to that end. Congresswoman Bass asked this question, and I'm going to be redundant here. I think I know the answer. Chemonics has been paid. One party to this contract has upheld their side of the bargain. Am I correct? That would be us paying them the portion of the $9.some-odd billion, $9.some-odd thousand dollars in the contract. Chemonics has been paid, correct?
Yes, sir. They haven't been paid 9 point.
Nope, I understand,
Yes,
because the contract's over a number of years.
Yes.
But they've been paid, and was their pay, was their pay docked? Was it prorated based on their failure to achieve on-time in full delivery?
I'd have to get back to you that. The bulk of the cost of this contract is indeed the commodities themselves, so the purchase of the commodities. That's where the bulk of the...
But to Congresswoman Bass's point, and I wish she were still here, there is some overage because they have to make some money. I have no problem with dealing with for-profit entities whatsoever, but they shouldn't be bilking the taxpayers, right? They should make cost plus $1 so that they can support the individuals who make the organization run. And the reason we work with for-profit entities is because there's an incentivization of efficiencies, and we should choose, because I'm going to get to the RFP process in a second, the people who can give us what we need at the best cost, right? That's what competition and free markets are about. But I would wager, and I do want to know, and I got staff here, and so a lot of times in these committees I watch my peers say, could you get back to me on X? If you don't get back to us on this, and again, not a threat, I love you guys. If you don't get back to us on this, we're going to get back to you, because I want to know, can we see a list? You said individuals from Chemonics have been fired. I would love to have a list by full name of the individuals at Chemonics who were fired as a result of the failure to meet the requirements of this contract by Chemonics. Can you please produce for us who got canned and when directly related to this failure? And I know you can't today. If you can, I'd be shocked and impressed. Can I get one of those? Can our office get one of those?
We would certainly be happy to share the names of the people who were removed from the project and moved off the project.
And I would ask, I don't care who was moved off the project. I want to know who got shown the door. I mean, what happens all too often is you waste government money and you get moved to another department, right? So if you can get that for us, that'd be grateful. I'd be very grateful, and I'd like to make that part of the record per the chairman's suggestion. In the filing of the RFP, has there been any OIG review of USAID and PEPFAR decision-making and decision-makers as it relates to pre-existing relationships with individuals at Chemonics? Any OIG review of the process of awarding this contract, this $9+ billion contract?
There is currently an OIG review on the performance of the contract, I believe. I can share with you exactly what the questions are. There's also another OIG review that's looking at what happens at country level and how product is protected and how do we manage the risks of theft at country level.
As well, I understand the country level
your,
theft thing for absolute. I mean, we want to help the nation state, for example, of Afghanistan, and we send $1 over there and 50 cents trickles down and 50 cents is pilfered. We still have a duty, I think, to try to help. But we need to reduce and minimize that pilfering. Has anyone ever reviewed whether there were any pre-existing relationships between staff and leadership at Chemonics and the U.S. government staff, USAID and PEPFAR, prior to the awarding this contract? Whether there was any nepotism, any sort of pre-existing friendships, et cetera?
So there's not been an OIG review. However, at the beginning, when one signs on to be part of this procurement panel to review proposals, et cetera, you are required to sign a conflict of interest statement that shows that you have no conflict of interest for any of the proposed bidders or anyone listed on the proposals. And that is part of what is indeed reviewed, is part of the oversight of that process. And
can you provide to us a list of the decision makers who would have been responsible for the RFP process as it related to the $9+ billion awarded to Chemonics? By name, can we know who those people, who those decision makers were?
We've certainly shared the information about the membership on the committees with Chairman Royce, and be happy to share that again with you.
Thank you very much. So, do we have any? And this is really the $64,000 question, if you'll pardon me using such paltry small sums. Do we have any idea the impact in human lives of a sub-500, and I just do that averaging it over the length of this contract so far, of a sub-500 OTIF, on time in full delivery, Do we know how many people aren't alive? I understand that they try to give you 3 months out, but when you're at 7%, you 3 months out mathematically, there are people who are going without this treatment. Do we have any quantifiable sort of data on human lives?
Well, as I mentioned earlier, this is something we've been paying very close attention to and looking for and trying to identify where there may have been issues as a result of the late deliveries.
Completely, with all due respect, the answer then would be no.
We don't have that data. There are, as I mentioned, there are two places where there was programmatic impact as a result of the late deliveries.
So I'm going to walk this dog 2 more steps farther down the trail here. So we don't know the loss of life. Do we have any way of knowing the number of people who might have been infected by virtue of the failures in delivery?
Yes.
And do we have any way of knowing the number of children who might, because PEPFAR has done good work, do we have any way of knowing the number of children who might have been born infected with HIV by virtue of the failure of Chemonics to uphold their end, which would allow for on-time delivery?
Well, just to, as I mentioned, there are these 2 instances in Ukraine and in Nigeria where there was a delayed, people were delayed putting on treatment in Ukraine, and a BedNet campaign was delayed in Nigeria. And that's the only programmatic instance we know of, and we have continued to look to see where there has been other programmatic issues or where there may be that kind of impact that you're talking about. That is exactly what we want to do, everything we can to avoid, and work very closely with our partners on the ground to make sure that we're not the stockouts, that we're not the kind of impact that you're describing.
So in closing, and at the risk of redundancy, I would request humbly before the committee and on the record that you produce for our office a list of individuals from Chemonics who were released, that is terminated, not moved from one department to another, as a result of the failure of Chemonics to uphold their contract with the citizens and taxpayers of the United States and the citizens of the world to whom we made a commitment. I'd like a list of who got fired. I would also like a list of decision makers as it relates to the rewarding of the RFP inside of the apparatus wherein that decision was made. As soon as possible. I'm very curious as to any quantifiable numbers on the loss of life, the infection rate, and the number of children who might have been born HIV positive as a result of these failures. And I would also like to see, in sort of a simplified version, the plan of action moving forward as it relates to how we avoid this in the future. Something, even a 1-pager. What are we doing with specificity? And again, and I want to sincerely apologize to you because I'm not after you, but I'm after this. This isn't right. We have a good program that's working that helps America save lives and save American lives down the road, as I see it, by virtue of building goodwill in the global community. And what it looks like here is that the taxpayers have been defrauded.
So if I could just mention a couple things, and certainly about the path forward, but also just to be clear, they did indeed buy and deliver the commodities. There was not fraud.
I totally understand that. You're absolutely correct.
Right.
It was never timely, ever. It's still not timely by our goals at 80%. And let's say that the profit margin is 10%. 10% of $9.X billion is still $1,000 over the course of the entire contract. I know it's not that yet. It may only be $100 million. Where I live, that's a lot of money. And again, and tragically, we could do this all day with 1 million different programs. But if somebody's in this building, thanks to Congresswoman Bass, thanks to Chairman Smith, don't start shining lights on this, it's a death by 1,000 cuts. And again, it becomes hard for me as a fiscal sort of watchdog to justify to my peers why foreign aid matters, and by gosh, it does. So we need to do this right, or else we're going to stop doing it, and then that's dead human beings. So again, I'm not trying to lecture you. You guys are doing good work. Please get us this data. I think there's some next steps that can be taken without cameras rolling. And again, thank you for 1984, a lifetime of service. Thank you as well, Dr. Burks. And again, please in no way, shape, or form mistake my tone as attacking you. You were defending something that's entirely defensible, entirely good. But we got to get it right. We have a duty to get it right. Thank you, Mr. Chairman.
Thank you. Thank you, Mr. Garrett, and I want to thank you for your leadership. You know, Mr. Garrett's a former prosecutor, and he does ask very incisive questions, and I do appreciate that. He's a real asset to this committee. Let me just ask him final questions, and if Mr. Garrett has any further questions, I'd be happy to yield to him again. Before Chemonics was awarded the contract in 2014, were there reports from the field regarding past poor performance, such as from Ethiopia? Next, if you could, in the continuum of what we would hope would be a high-performing supply chain, where were the glitches on this one? We know it's delivery. I know I don't know, but I believe that UPS was one of the losers in terms of the request to be part of that consortium. Who actually does the delivery? Is that where the glitch was? Where was the glitch? I know the IT problem is very real. Hopefully it was. Let me ask thirdly, do you have the authority to penalize a non-performing entity? And if not, if you can get back to us as to whether or not you think that would be advisable. I have many instances in my district over the years where we've had poor performance on the part of a low bid contractor, or any bid contractor. One of them was years ago with an outpatient clinic that I worked for 10 years to get for the VA. The low bid got it rather than best value, which I thought was unfortunate. But frankly, they were a year late and then a year and a half late. An outpatient clinic means veterans don't get the care they need. So I petitioned the VA to use their authority to impose a daily fine in order to get that job done. All of a sudden, there were workers all over that site, and they got it done very quickly. But it wasn't until the sword of Damocles, a serious threat, was just offered as a possibility, it was imposed that they got the job done. Would that authority be helpful to you? How many other contracts are there? And can you perhaps provide us some insight as to percentage of vis-a-vis others in that same realm? And has or will Chemonics' deficiency in delivery, on-time delivery, affect the future of any awards? When a team looks at a new project and Chemonics comes forward, short of disbarment, past his prologue sometimes, too often, will that become a factor in whether or not they get a new award?
Great, thank you very much, sir. And I don't have the information on what past performance information in front of me. We'd be happy to share that and take a look at that information. We'll get that to you. In terms of the glitches were things that we had identified, and it certainly was in what was proposed in terms of the management structures were not working as we expected. So among the things we asked them to address, and they proposed to address as part of the action plan, including accelerating the MIS system as we discussed, restructuring the supply chain operations. And this is also moving staff off, as we've also discussed, changing the project leadership, and transitioning to a regional warehouse distribution system and a number of other things. So there were glitches and things that were not moving through the system as they needed to, and the information and the requests were not moving through the system as they needed to and being processed in a timely manner. There were also issues with making the estimates of when something would be delivered, and that was also a piece that they did improve and make sure that the estimates that they were making really did reflect what was a much more likely outcome, which is hugely important. So penalizing poor performance, we can happily share this there and how the contract is structured in response to.
And again, in the idea, if that authority does not exist, it's something we would, with your concurrence and working, in a way that is likely to lead to the best outcome. It does work in other government agencies. I know it for a fact. It might work here.
Yeah, I'll have to get back to you about that. That's not information I have. And I also will have to get back to you on how many contracts Chemonics has. I don't know. I will say they have been very responsive to the action plan and have improved their system, which we're encouraged by, but as we've noted, they're not where they need to be as yet. The poor performance, as I mentioned earlier, in this, the database that for every contract you have to give reports on a regular basis about what's the performance of a contractor. And it is something that everybody across the federal government uses when you're choosing based on past performance. So it is an extraordinarily influential piece of information. And as I mentioned, Chemonics did get a minimal rating early on, and we will continue to have that documented as they...
Now, has that affected any contract let since
there's no way I could answer that because I don't know what decisions others have made.
But in terms of were there contracts to Chemonics after all of this became known?
I don't have that information.
Could you provide that? And it would be interesting and insightful to know whether or not that minimal rating was taken into consideration or just bypassed.
I mean, it's certainly something, as we looked at, did the past performance, that would be something that would absolutely have an impact in your ranking of, or your assessment of a bidder, is whether they've had that kind of rating. It would make a difference, but I can't speak.
Again, in another agency, this was DOD, I had a big fight with a contractor that was providing security services at Earl Base, which is a naval base in my district. It's a munitions depot. And we discovered that the poorly performing contractor for base security, not the Navy, but the others, were just doing a very poor job. And I knew it when a whistleblower came to me and said, I kept noticing one of the people they had hired, and I kept saying, I know you. Couldn't figure out where. He was a former Jersey City police officer. And then middle of the night kind of thing, I said, I arrested him once. Here he is, had not been vetted the way he should have been. I brought it to the IG, I brought it to the Navy. It took basically, seemingly forever to get that fixed. This is base security. And then they finally, only because I just kept pushing, decided they didn't disbar, but they made it a very strong, because this was a truly not, they didn't do the training that was required. So, I think agency-wide, government-wide, we do have a problem everywhere, and I've had a lot of experience in my own district where this has happened. So, again, if Chemonics got a number of contracts after this, my hope would be that this would have been taken into very serious consideration when juxtaposed with another person that was, or group that was trying to get that contract, because failure to deliver on time is very important. So, if you could get back on the authorities,
I would be happy to get back to you
those,
on some of those other questions. Absolutely.
Thank you, Madam Ambassador.
Just a quick comment. At the same time, with the Chemonics issue, and I heard about the industrial standard of 80%, at the same time, we're asking countries to have 90% of their population aware of their HIV status. So the world has changed to a much more rigorous, much more accountable, much more transparency in our frame. And I think all of our systems need to get to that same place. If we can expect that 90% of children know their status, 90% of teenagers, and 90% of adults, we need to expect that we're all moving with that same level. Is it hard to work for PEPFAR? I think it is very hard to work for PEPFAR. The demands, the fact that it is absolutely life-saving, and it's a difference between a mother being diagnosed and put on treatment that day or not. And I think, yes, our standards are probably the highest in the world because of the issues of us trying to stop an epidemic. So I think part of this is we continue to move at a very aggressive pace, and I think everyone on PEPFAR needs to continue to move at that aggressive pace. And I think over the last 3 to 6 months, we've seen a real adjustment in the speed of work with the supply chain, with the countries, and with these elements in this interagency way.
I know you, Ambassador, have to leave to go to the Senate side. I do want to thank you again for your patience with that long interruption. Your information has been, and your leadership has been extraordinary. We will follow up with, let's work together as going forward. Obviously, it's all about helping victims. Hearing is adjourned.